Okay, another program. So help baby breathe. We went to the hospital. Of course, that's one of the hospitals at Mwananyamala. You can see the volunteer, Ms. Rukia and Ms. Charlotte there, and with Dr. Dina Komakoma, who is holding the baby there. And all this is the postpartum moms who their babies are in the NICU. So they were sitting outside waiting for feeding times. So then, of course, these are the baby already most compromised. So they're going to be going home with the moms soon when they're getting better from their NICU. So then they were showing them how to take care of the babies and stuff and cover them up. And of course, all the same regulation to make sure, identify if the baby is too cold or too hot and baby's awake, feeding time and stuff. So they were talking to them. So you can see all these moms are very happy. We were able to give 250 package that was made with the blanket, the onesie, the little hat, and some of them has the little diaper or cloth diapers. So those are the projects that, again, we're going to work from the beginning. People who wants to do that project from the beginning, raise money, get the blankets enough to go and give it to the hospital and distribute to every single mom who is at that hospital. At least they know that their babies have little blankets and they've been taught how to cover the baby and make sure the baby is safe, stay warm. So we did 50 of, we gave 50 of them at Kilo because when we got there was only one mom delivered. And then the second day, I think there was only the second mom. So we left the other ones with the nurses so they can give at the Kilo hospital. But for Mwananyamala, every single day that we were there, we were giving like 50 or 70 because there are so many moms, so many units to go to, starting with the C-section post-op area. We have to go to nursery where the moms are having with the babies. Moms are discharged and baby stays there for feeding and the growth and stuff. And then we have NICU who had so many levels there. So all the moms there got their blankets. And then, of course, they talk to each other. So when you go the first day, they gave like 70 of them. And then the next day we came back, the new moms who came to the same unit, they would tell the nurses, so when are those American people coming back? I didn't get the blankets for my baby. So then, of course, they call us and then we go and give it to them. So we go to other units. They have 4 or 5 moms last night. The moms who are there in the morning, they show off the stuff because they in the ward, everybody sees that. So it was interesting and it was like everybody is waiting for, when are they coming? When are they coming? Okay, here they are. So, but it was a very rewarding thing to see that they appreciate that we took the time and go and give it to them. So every single baby who was in Mwananyamala for those 5 days we were there, they got the blankets and stuff. So we were able to give at least 250. And then the rest of the stuff that we could not, we didn't have like a full set. We gave it back to the nurses, especially in the labor and delivery. So when every baby was born, even if we were gone, I think we left another 200 blankets. You see them on the at the end when we're giving their donations. So every baby was going to be given probably for another 2 weeks because they have a huge number of delivery for that hospital. So there's a lot of work to do for us, but at least for the time that we were there, every single mom who delivered there got their blankets from us. So it was a blessing, definitely. So you can see this was an C-section post-op ones. One of the mom who delivered in a couple of days and she was getting ready to go home. She came and asked, oh, I didn't get the clothing because when we were giving the blankets, she was breastfeeding at the NICU. So she had to come back. So she asked us how to show us. So we were showing us the cloth diaper, how to put the baby, and then put the baby in the pin and stuff like that. Because some of them are just used with the, doing like 3 portions of the cloth and tied. But the cloth diapers are different. You have to do a little different technique. So when I asked her if she knows how to use the cloth diapers, she said no. She knows how to use their cloth, the kangas, to do the triangle, and then you wrap the baby for those 3 legs of the blankets. So we were showing them there. And here, of course, the next
yeah.
We wrap the baby and then
you did good.
Yes. So that was the postpartum unit, Dr. Donna Komakoma. She's one of our volunteers. You can see she was showing them how to do that. Okay, so compression now, ventilation. So we went to Kilwa. Okay. Let's continue. Chad. No. Chad, yes. You still continue. Clear. Until he said it clear. So if he said it doesn't say clear, you keep continuing until he said clear. Go ahead. Chad, continue pumping. Say next. Loud enough. And then so. Oh no! Code blue. So this is what when we were at the Kira hospital. So they had the defibrillator, but they were not using it because they didn't have the training to use it. So thanks to Breathe there and Tanya, who we were getting a heart rate to show it on the monitors. So, and of course she was laughing so hard and it was going too fast. We were like, oh my goodness, we're going to end up using the defibrillator on her if she's not slowing down her heart rate. But it's something that you find out people donate stuff, but they don't provide the education to the nurse and the doctors. So it is unfortunate. However, when we were talking to them, we were teaching them the CPR. And then one of the doctors, who's one of the policemen, person, and he said, so what happens if we do CPR for 5-10 minutes and still does not come? So what is going to be? And then, of course, Bree responded, if you usually have a defibrillator, you should be able to put the patient on the monitor and then figure out what the rhythm they have so you can see if you can shock it or not, or if it's not, then we have to do other stuff. The HNTs, healthcare people knows that part. So then one of the gentlemen said, yes, we have that. And then so when they brought it, thanks to Brie, and she started showing them how to use it and do the shocks and stuff. So it was a blessing to see that the nurses use their expertise to try and teach them at the moment, right then and there. And then, of course, Tanya being a good sports person, and she was our guinea pig to use and show them, the heart rate. If the patient is on the monitors, how do you read the monitors? How do you detect what you need to do if the rhythm requires shocking and stuff like that? So it was very good. And then, of course, that's why we realized then at least they need to know the rhythm. So thanks to Bree, she works throughout the night to try and get this lesson so quickly. And thank you very much, Bree, for everything you do. She was able to get that lesson to the people at the Kira hospital. And then so they were able to do that. They were asking questions. So they were able to understand there's just a basic EKG and what exactly need to do, what rhythm, what do you need to do. So it was great. And we're going to try to do it more now in depth to make sure they know the rhythm and the medication and what do we need to do. And thank you for Dr. Mrs. Akimbi, who was one of the pharmacists we went with, and she was able to relay the information about the medication, the dosage, which medication you give when and why and how. And then so she sat down, pulled the chair, and started discussing that part. So it was a very beautiful sight to see. And we're going to show all these projects later on when we are concluding all the videos with each project, so you see how much extensive your expertise is needed when you get to go and do this mission. So that's why I said the mission is not for outing or like a catwalk. No, you are going to work and be able to share what you know for somebody who does not have those resources. And then so they learn from us. And it was a beautiful thing to think. Thank you.
See the electricity in the atrium and the ventricles.
And thank you for Josephine. She was translating everything. Yes, so then of course they were showing up, as you see the rhythm over there. So we have, this is the area that also we need to work on and to try and find the monitors and, like the simulators to be able to show an actual rhythm and what do we need to do. So that is the future projects that we need to do. So we have to go in depth, not just only giving them the basic rhythm, the basic and common rhythms that could happen to a patient. We need to go deeper because they do have an ICU, but they need to be able to understand if the patient starts showing all those irregularities, the nurse and the doctors need to catch it and be able to help that patient. Okay, at the end, you improve patient safety. So it was great.
You're going to turn it down just to see the monitor. Tissue saturation and the blood pressure, okay? So this is for not a code blue, but maybe the patient, you notice the patient's blood pressure is going down, the patient's having trouble.
So there's, as I said, there's a lot of, we're going to share later on longer videos so you can see the actual training. Okay, so with all these 3 days at the Kilwa Hospital, we were able to see, to teach 72 healthcare workers. The nurses and the doctors came, and they were very, very eager. They were asking a lot of questions, and it was very nice to see. Definitely, it was very nice to see. Okay, so when we went to the Mwananyamala, the picture on the left there, you can see Dr. Dina Komakoma and Miss Audrey doing the infant CPR, so teaching them what you need to do. And then the third person from the right, that's an OBGYN at the Mwananyamala. And then the rest of you guys know. And then there's another pharmacist behind Mary there. And then Miss Rukia was there. So they are both teaching CPR. And then, of course, on the right side, you can see the video that on the left there, you can see Dr. Dorothy shows teaching the Help Baby Breathe, and Miss Tanya is right there, and Dr. Kimbi is in the middle there next to Fande, I think it's Fande Shije. So they were all teaching the Help Baby Breathe and the infant resuscitation. And then they were seeing the demonstration. You can see people, there was like maybe 35 at one time when they were teaching that part. So as I said, your expertise is needed when you go over there. And then on the left picture here, you can see Dr. Dorothy doing the thermoregulation, and then, of course, helping the newborn transitioning from the delivery. How do you assess the APGARs, and what are the things that you need to do? You can see everybody is very attentive. So after they finish the big group of 32 people, like in the class, then we break it down to like 4, 5, or 6 people in each group, so they can have that intimate discussion and the interactive, getting them to practice and perform those tasks. You can see in the right picture, Dr. Kimbi and Dr. Dorothy and one of the funded there, they're learning which correct size of the mask need to be selected. So those are the things that we need to think. If we're doing the thermoregulation or infant CPR, we have to have correct mask size. So we have to have our own team or equipment that are needed for teaching, so we can have a full training. Let's start sampling things here and there and whatever. So those are things that we need to do for future team. And that's why I said when we're recruiting for team, we want to make sure the team knows what they need to do from here. They have all the equipment, all their training. And then when we go there, it's a complete training. So, but they did an excellent job. We can see everybody's paying attention of every word they say. And of course, we had so much fun.
But you want to make sure that the noses are covered completely. And you don't want a mask that is so big. And see, look, I could actually cover the mouth and the nose and get the eyes and make the baby's heart rate slow down, which I don't want to do. Yeah. That would be an unseemly complication at this time.
Okay, try this big one. See how it fits. See?
That would not be good.
It would not be good. You will have a seal. Okay.
Okay, so when we went to the unit, one of the unit in Mwananyamala, when we were working, I think it was like orthopedic unit. So of course, Zibri felt at home. As soon as she saw one of the orthopedic patients, she just realized the urine bag was hanging on the bed, and she does not like that. So she got creative and get her own gloves and tie it and hang it on the side, because remember, you have to have a straight line so there's no backup of the urine. So as I said, you have to think outside the box and be creative and do what you need to do to help that patient. So then there's no back row, so the unit just straight go to the back vessels, just in the bed. And then so on the right side, you can see Miss Audrey. So some of the people, maybe they're being short and the table is too high, so they put everything on the ground. So then, of course, we have to start doing CPR on the ground, and then still to help them to make sure they get the correct positioning of their hands and the correct landmark on the patient's chest to try to resuscitate the patient. Okay. CPR in the community now. So we did go to the school, and then we were able to go to Minazin, and then the first day of the second week, we were doing CPR to the training the teachers. So there was like 30 teachers there and staff members, because remember they have 950 children. So of course they pass out. We don't want them to not know what they need to do. And they were telling us, just in case if somebody pass out, they get a little paper. I mean, they try to wake them up or get a little paper and start fanning them to try and, I can give them a cold air to try and wake them up. And majority of the time, probably the kids, when they pass out, is because of the heat exhaustion, because it's hot all the time, and the kids are playing outside for a long time. And that's why we did the hydration program, because the kids need to be drinking water in those dry area. But anyway, so the teachers were doing the training, and here Bree and Marim, I think Sarah and Mary behind there, they're doing the training with the teachers.
Yell for help. Help! Help! Okay, now start. In between.
And so, yeah, so there's 30 teachers and 5 staff members at the school. So we want to make sure they do at least the basic identification if somebody was in trouble, and screening while they're waiting for help, just to try and do the basic CPR. And then, of course, when we were talking about the CPR, and then some of the girls said, oh, I have a 3-month-old. And because these 6th grade students, usually they're like almost 11 or 12 years old. Some of them are 13 years old. These are the ones that they stay home, like babysitting their little brothers or sisters. So when they said what happened, because we kept saying child and adult, they're like, what about my little sister? Like, how old is your little sister? She's like 3 months. We were like, oh, so then we need to do infant CPR then. So then, yes, all the little kids who have their brothers and sisters less than a year, we told them to come in the front, and then Bree started showing them how to do CPR for their little one while they're looking for help. Instead of just running and leave the little brother or sister alone, then do these things first. So, and the girls, the kids were jumping in there. There was 96 6th grade students, sorry. There was 96 students in that 6th grade class. So all of them were in one class, and then so we were teaching all of them in that class. So we had to divide almost 4 stations to try and get every single child to do their CPR, is for adults and child. And then there was like 23 who have a younger brothers or sister less than a year, and then they were able to do the infant CPR. Because we were trying to save time. Instead of teaching everybody the infant CPR, we taught the ones that have the little brothers or sisters at home. Okay, so for postpartum hemorrhage, so we did do that one in Kilwa. So those 92 people we were teaching postpartum hemorrhage, to try and see what exactly it is, how to identify. With that, we give you more videos of that, but go to the next one. And then, of course, also Bree did some of the quantification of blood loss. So just knowing that the patient is bleeding is not enough. Guessing how much the patient is bleeding is not enough. So then we had a little activities that people have to guess how much is on the pad to see if a patient is bleeding, can you identify it? Here in the United States, of course, we always say quantification of the blood loss will help identify patients at risk early and start treatment early. Estimation blood loss was going to delay care, because if you used to see blood all the time, more likely you're going to underestimate it, thinking that the patient did not bleed too much, and then hence delay care. So we were trying to show the difference between the two, estimation versus quantification of the blood loss. Okay, so with part of the postpartum hemorrhage, we went to the C-section room to observe and how they do the C-section, how they prepare the patient, how do they attend the patient intra-operating time, and then afterwards, what are the things that the assessment we do. So we did that, and we have Dr. Mzava with us, the OB-GYN on the right there. So we went and realized that when we're going to the OR, a lot of supplies are needed. Like even the little hats or the mask or the gowns for the people who are doing in there, they need. So the bed on the hospital bed needs the sheets. The patients are laying on the plastic cover that, yes, they can wipe between patients. But we all know for the infection prevention, usually the breakdown of the theater needs to be done, and then it has to be cleaned up quickly. They have so many patients are having a C-section because they have a bigger volume, so they have to turn around the room very quickly. So there's a lot of things that we need to work with them to try and make it more efficient and more safe for the patients. But they were so happy to share with that. But of course, Miss Tanya, since she's heard about the babies coming out, she showed up to come and do assessment of these brand new babies. So this is one of the mom who was so happy. We were in there, and of course, she got the gown, she got the things that she needs in the OR, and her bed has beautiful bed sheets, and then she was so happy with her baby in her chest. So this was the full-term baby, and mom was a repeat C-section. And then, of course, Bree does not miss a chance of playing with the baby in the warmer and doing assessment. And, so the baby needed to be warm because the temperature was very close, like 97.2, I think we wanted the baby was. So we had to put the baby on the warmer. And then, of course, they're putting the warmer on and cover the baby with the blankets. We're like, no, we have to use the stable setting. So the people working in labor and delivery, you will know that usually the warmer can be controlled by the baby temperature, which is it's safe for the baby because it's not going to overheat the child. So we were able to play around with the warmer, and the warmer was able to work the way it's supposed to be and to stop alarming. And the baby was there for probably 15 minutes, and the baby's temperature was good. And then, of course, we recheck and give it back to mom, and mom was breastfeeding skin to skin, and everything was good. So it was a great experience to be able to use those things in there. And of course, we wrap the baby back and then give it back to the mom, and mom was so happy with it back. Of course, this baby also had, we wait to give mom the thermoregulation kits until mom comes back. So we wait until mom went to the C-section units, and then so we were able to do that part. So mom was awake, so she'll be able to do herself those thermoregulation care of the baby. So we did observe 3 C-sections, and then of course assess the warmer, the hairnet, the PPE, all those things are needed for the OR patients. So we're going to start working with them and see what we can do next time when we are able to collect those things for them. Okay, for anesthesia, yes, we didn't have Dr. Gwen with us, so we are working on to try and get people to go and help. But Bree was able to go there, of course, in the ICU and work with one of the clinical nurses to be able to set up the defibrillator. This is in Mwananyamala now. Mwananyamala do have a lot of equipment in the ICU. So, but then we were able to, Bree was able to work with him to try and figure it out, to set up the emergency cart and stuff like that, crash cart ready for if there's any cardiac arrest or respiratory arrest. And then so she was able to get a lot of stuff going. We were able to put those monitors on. That time they have a couple of patients on the monitors, so we were able to work with them. And then, of course, the mask. So they do have reusable mask. And of course, here in the United States, we use the disposable mask. So we do have to continue working with them to see if we can get more supplies and continue providing those support for Mwananyamala. But their unit is beautiful for ICU, definitely. We were able to see, to talk to the nurses. There were 8 of them. 2 of them were doctors, and 1 of them was anesthesia. So we were able to talk to them about the crash cart, and Mrs. Kimbi was in there too, and was able to work with the pharmacist to try and make sure the crash carts have the right medication and what they need for emergencies, labeled and all the stuff. So it was great for the pharmacist. And Lucy was there too, Lucy Mkini. And so we did donate all these tubings. You can see the blue tubings. So that they were trying to see if they work on their monitors. We got a lot of tubing for them. So they were trying to see how it works with their filters and stuff like that. Yeah. So the blue is ours, and then theirs, there were white ones. So they can see it fits perfectly. And so we were happy to see that it was working, yes. And then so the vents and stuff were connected and stuff. So that's why we need a lot of ICU nurses and doctors who are willing to come with us next time. So you can go in there and help them to set up and take care of the patients and do all those monitors and stuff like that. Okay. And then, so as I said, they are doing the reusable mask. So after they use the patient, they go and sterilize and put it back. So those masks are made for being reused. But we are always wanted to make sure that if we can find the usable ones and be able to give them enough supplies, yes, because they had only one in one crash cart. We said, no, we need more than that because they have, I think, 8 beds in one ICU. You need more supply than that because in ICU, you're going to need that more, definitely. Okay. More community CPR. So we went to one of the magnet youth soccer clubs, and this is one of their teams. So we were sitting, all the volunteers were sitting there, and then we had the coaches and the leadership at Magnet. They're very grateful to for us to go and do CPR with their athletes, because there were 53 athletes there. So when we were doing the CPR training. And then so Bree started leading that training and demonstrating for them. And then we were trying to do CPR with one of their, I think we had probably 10 athletes come and practice. And we were telling them, yes, they're physically fit, but do you think you can do CPR for 2 minutes? Some of them like, oh, sure, I can do it. We're like, okay, so we're going to time it. So as soon as they get to 1 minute of CPR continuously, they're like, oh, this is hard. Exactly. So it's not simple when you see somebody else is doing CPR, if you're doing correctly, because if you're doing correctly, it's going to tire you up. And that's why these guidelines that you do for 2 minutes and somebody else have to do it. So we have to relay that to these young kids who are very athletic, but also they need to know that because they are overworking their heart more than anybody else, also their heart can get tired and stop. And then so they need to be aware of food-wise and injury-wise, but they need to also to know about the hydration stuff. And then so there's a little video. I'm going to play just a little bit of the video from the magnet. Hope you'll be able to see it.
Friendly match between Magnet Academy and Minazini.
Can you guys hear it?
Yes.
Okay, thank you. Okay, let me start again.
Friendly match between Magnet Academy and Minazini Primary School and donation giving arranged by Magnet Academy and QHSC. Top of the line referee.
Yay!
Coaches of both sides.
UFL. Okay. My perspective, you are fair. Yes. So yeah, you appreciate it very, very good. All right. Yeah. So thanks very much for our partners, QHSC, for this event. And thanks very much for teachers and coaches, especially Asma, for this event. And thanks very much for all the players from both teams. Mmekuwa na mchezo mzuri. Tunashukuru sana. Mmetusaidia kuweza kufanikisha tukio letu. I'm not the one who's supposed to.
Okay, so we share that video in length because it's a little bit longer. But yeah, just you can see, thank you, Dr. Kimbi, for referring in the game and did an excellent job. So thank you very much. So this was just the pictures of the team for Minazin. They're wearing the QHSC shirts. And then the team for Magnet, they're wearing the pink shirt from their team. So it was supposed to be a friendly match, but I didn't know the kids were very competitive. They wanted to win so bad, but they did an excellent job, Magnet and QHSC. So it was very nice to see the kids playing hard, very working hard to try and meet their goals of being a team player with each other. And so it was very good things to see. Thank you, Dr. Siakabe, for organizing that part, because without that, we would never have those friendly matches with them. So now the children are looking forward to do that, just that. Can you give us a little background, Dr. Siakabe, about how it came up and what is the future plan for now?
Ndio, asante. Yeah, so just trying to come up with something. I know that the school has been working with a lot of the young men there because they're hang around a lot. They tend to be, or they used to. They've worked on it. They've done an excellent job. They used to just have like a lot of aggression amongst themselves. They also, always just kicking things around. We take soccer balls there, but they tend to run out very quickly because they take a beating. The kids are always kicking them and they want to play soccer and everything. So said, you know what, we got to find something for them to do. And actually, there's also a young lady on the team. I don't know where she's at. I'm looking. Most people wouldn't know that she's she's a young lady, but she was very. Oh, there she is, right there. She's kind of in the middle between. There's a magnet player in the pink, and then there's one in the yellow shirt standing like close to the middle, and she's right in between the two of them there. She played really well. Um, so, but it's just something to give them, and it encourages them to be good students, to get good grades, to behave properly. If they don't meet certain standards and things like that, they can't join the team. So it's a motivator, and it also again gives them a certain level of discipline and encourages them to dream, you know, because that's what we're there doing is we're trying to give them hope and aspiration and encourage them to, you know, to do well in life and become, you know, pillars of their foundation. We also had a community, I would say a career day. So we had some of our volunteers go there and speak to them about their careers and their development and their goals and their professional development. So all of that kind of worked together. So thank you.
Thank you very much. And also, the result, one of the feedback I observed and heard after the game was that the magnet was extending an offer for the children from Minazini to join their team. So because their team is, I mean, it's like almost a travel team here in the United States. So they are dedicated, have coaches and stuff like that. So the children who wants to do that, they were given a flyer and take it to their parents at home and have that an option just in case if they're interested and the parents are okay with that, but then they can join. So those are the things that we want to inspire the children beyond their surrounding, beyond what they could. I mean, sometimes they just say, okay, I'm just going to go home and go to school and that's it because everybody else has not done anything beyond outside their house. So when the children have these options like that, and then you join maybe those teams, the travel teams or something like that, and then maybe they're good at it, maybe it's something that is going to help them, you know, motivate them, do in school and then go and do a soccer player. You never know. So it's a good thing to see they're so fired up and inspired and then so focusing on things or more possibilities versus just a limited environment. Because if you don't give them options, well, and one of the feedback when we were sitting on the corner there with Dr. Mrs. Akimbi and Bree and Mary, one of the parents is like, oh, the team, you know, the game brought, you know, the excitement in our surrounding, Kilio village, because we didn't have these kids, I mean, because the whole school were there to cheer them up. So it was like after school and everybody was so fired up. So you can see even the community was excited that their children are doing something more than the normal activities. So it was great things to see that. Thank you for organizing that.
I was going to say too, Denise says she has to leave, but she had asked a question, do we take cloth or disposable diapers?
I answered her privately.
Oh, so all right, thanks.
You're welcome.
All right, and then also like Dr. Gabone mentioned, so the Magnet, they're a travel team, but they also play internationally too. They're actually sponsoring, I think, a tournament. I don't know if it's this week or next week, the week following, where they're going to have like almost like a Tanzanian tournament in Dar es Salaam. So they're inviting all of these different programs. But they do have players there who are on scholarship. In other words, they sponsor that player so that they pay for their transportation, they get them to the practices, and then the children who don't have money for food and stuff like that, they'll feed them. So they're going to open up this opportunity as well to the students at Minazini, but we want to still keep cultivating the team because what we notice is that we have a lot of talent there. Those young children are talented and they are fire. So I think if they have a team, they can really project their talent, you know, out to the community and to people who are interested in talent and stuff like that in terms of football. So we're going to keep working on it little by little. So, and I know Bree has already started designing a jersey for them. So we're still working on that. So.
Thank you, Dr. Siakabe. Dr. Kimbe, your observation for the game since you ran it, you referee the team.
Oh, I was impressed at how good the local kids were. I mean, I was actually shocked because they outperformed the other team, and they have a bunch of talents on the team. Plus, again, it's great to see the whole school, especially the big school at large, getting to it, and each time they scored, there was a it was so difficult to clear them off the field. So I think everybody had a good time. I did, definitely did. Yeah.
Thank you for sharing, and thank you for even showing up. I mean, I know it was a very rewarding to see the children jumping up and down. So I think it's one of we're gonna probably call them Minazini Stingers. So this is the whole team there. You can see they're like ready to go, and their coaches and who are teachers are really, as I said, they were fired up. They came to play. So it was very good to see them, and they were happy that they were able to have that opportunity. I mean, I know Magnet did send on the people who were available, not necessarily that they sent a kind of elite team, but it's still definitely, it was good to see their competitive natures, their hunger for, like success and team and stuff. They are like really, really coming to play. So it was very nice to see them being fired up and how inspire them enough. So if we give them opportunities like that, definitely they're going to do something better for themselves. So it was good to see. Dr. Sakabe, you have a hand raised?
Yes. I was going to say that Minazini did win. They won the match 3-0, and that Dr. Kimby actually had to earn his pay that day because they were coming after him. The fans were trying to shape his calls. Some of the players were attacking him and criticizing him. So he was in a pitch battle there. So he did an excellent job and he kept his cool. So it's appreciated, and it added a flavor or a sense of reality to the match, even for those in the public who were watching, because we saw some of the other older folks start practicing and playing afterwards, and they didn't have the excitement that that the young kids had. So it's good to see that they were generating that kind of interest from the community. So
It was actually, I mean, we got to ride together to the field. That was exciting.
I know.
Oh yeah. And then when they saw Dr. Kimby come in there, they started cheering like crazy. Just walking through the little school area there. They were like, I guess they realized we were serious once they saw that. They were like, okay.
No, but as I said, I mean, it brings joy even to the community. As I said, for us hearing the parents who have never been to the school for after school activities, they were like, oh my God, the kids are here to play, that's for sure. So it was good. It was very good to see. Thank you guys for doing that. Okay, and then so that's what Dr. Kimbe was saying, that they were running like crazy.
Kids from Minazini were relentless. They were like, that's why we're gonna call them the Stingers. They were just everywhere attacking. It's like one of those games where they just don't let you breathe. You have to react quickly, or they're just fast and they're little and fast. Just say that.
Okay. we show more on the video that we're going to do in the school, because I know it's a lot of stuff. So once they score, this is the mob who just attack the whole field. They were so happy. And then you see on the background, you see that the ladies who are wearing the cloth in their heads, they were singing and practicing while the other people are playing. And then as soon as the goal comes, they cheer. Like the cheers, I mean, the songs were like built on the spot. So they were so fired up. They were there to do their job. But anyway, so enough of this soccer. Now the sanitary pad.
Oh, I was
So
going to say real quick too. So I know I posted a few times. So Minizini, we did create a Facebook page for them. So if you're on Facebook, like their page or follow them, and we'll post videos and pictures from the medical mission on there as well. And my heart is full.
okay, so one of the projects that I really love to see it continues and flourish as I've seen it. This is the second time we did. It was, yes, my heart did fill up when we were doing this project. And thank you for everybody who has a hand on it, raise money, seriously take this project to heart and come back and bring it joy. So we did get the sanitary pad, reusable sanitary pads. So we bought the package, and some of them had 6, some of them have 8, some of them have 10. Because remember, people were buying different individually. So then, yes, so some of them have different sizes, some of them have one size. So we know from now on, we're going to work on choosing one size that has, so one package that has 3 sizes. So people, I mean, the person who is receiving it will have, like different days. So if it's a heavier day, then, people know their menses, if they are heavier in the beginning or heavier in the middle, whatever it is. But at least they will wash it and be able to use it next time. So thank God for all the ladies who jump in and donate and buy and bought lots and lots of pads. Because I did not think we we're going to afford all these pads, but we were able to get so many of them. Dr. Dorothy, Miss Veronica's, and Miss Kia, Miss Charlotte, Bree, Tanya. I don't know what to say. I have no idea. I was almost in tears just seeing the little girls, or young women, I should say, tear up, so excited, eagerly, and you can see the stress on their face disappear. Because remember, these are the girls that are missing school because they don't have pads. It's unfortunate. Like when you're living in America, you're not thinking about that. But because if I'm running out, I'm just going to run at CVS or Walmart or whatever, or order Amazon to bring them tomorrow morning at 4 a.m. They don't have that option. So these are the girls that when they're getting this, and they know I'm getting the whole package by myself, not only just 1 or 2. So you can see their relief on their faces. And the teachers were so grateful. And we had so many of them. We had 350 packets, which has either 6 or 8 or 10. Can you imagine if you take amount of that much money for these girls, but you save them for the whole year? Because you can use that package for the whole year. Because every time you just wash, remember, it's once a month. So for 4th grade, there were 67 kids. 5th grade, there were 42. 6th grade, there were 61. 7th grade, there were 47. And then there was 30 teachers, and we send 40 at the hospital for postpartum moms to try and help them, because some of them came and they don't have anything. They give them the cotton to put in between their legs. So we know there's a need there. So in future, I will hope that the sanitary pad for young women will include also for the for postpartum moms. And then also we left 60 of them with the health teacher at school, because we have the 3rd grade who are going 4th grade for next year. Because they've not gotten to the time now, but just in case, then that we have something given to them from the school. Or if the girls show up at school and they didn't have any, and then the health teacher can share. So it is, it touches my heart to know that at least those girls for this year, they're covered. So can you imagine that now they're going to be focusing, okay, I can go to school without any problem. So it was just, heartwarming for me. So with that, thank you, Ms. Veronica, for a beautiful speech, which we're going to share it as a whole project when we're getting the video to this and use it for fundraising for future. I'm just going to play a little snippet for it, what she said. It was beautiful, beautiful summation of why we needed to do this.
Could not go out in public. walikuwa hawatoki nje kwa watu. They were considered unclean. Walikuwa wanaonekana kama ni watu ambao ni wachafu. So they had to go into a red tent. Walikuwa wanakaa kwenye and in that red tent, they release the blood. Wanatoa hiyo damu sasa inamwagikia hapo kwenye hiyo hema nyekundu. And after the blood was released, they had to be cleansed before they could go around the public. Kwa hiyo inapokatika hiyo damu, wanatakiwa kwanza wasafishwe, alafu ndio waende wakachangamane na watu wengine. Today, young women can go to school. Kwa hiyo wasichana wadogo walikuwa wanashindwa kwenda shule. Shop in the market, kwenda kwenye maduka au sokoni. Walk the streets, kutembea mitaani. No matter your religion.
Yes, so I mean the video is almost like 7 minutes, so but it was a beautiful tribute for what happened previously years for the girls and what is happening now and what we did as a QHSC to support these girls. So yes, thank you, Ms. Roslyn and Mrs. Dr. Kimbi and Ms. Tanya, for everybody who was there. It was just a very, very touching moment. So thank you very much. Ms. Veronica, you there? You're feeling to that project, or Ms. Tanya or Mrs. Akimbi?
I know she said she was leaving, but I'm not sure if she's still here.
Oh, okay. Mrs. Akimbi, anybody who was there wants to share a little bit? Ms. Roslyn, Ms. Charlotte?
Well, this is Charlotte speaking, and I was amazed at Veronica when she made that speech. It was well needed for the young girls to know what happened before them and what can be for now. And just hearing it myself, it affected me because I've heard stories, you know, and I was told stories about that. But for those girls to hear it, and they were well receptive of the story. I was watching their faces just to see the attention they were giving Veronica as she made that speech. They received it well. And just to see their faces, it was so touching because it just, I don't have daughters, I have granddaughters. And just listening to the speech and thinking about my granddaughters, because like you said, here in America, we have the pharmacy stores, the drug stores, the big chain stores where we could just go out and purchase them. And just to know that these young girls in Tanzania and many other places do not go to school when they have their menstrual. It's just it saddened me to know that they stay home. And God knows what happens when they're home. But for them to have these disposable pads, it's just life-changing for them. So I'm just in awe about it. And I just love the fact that we made a difference in giving out those pads.
Yes, no, I agree. As I said, I was trying to hold my tears so bad because I was like seeing their faces. Like you're right. When Ms. Veronica was speaking, seeing their faces to see how far they came. And then now they're going to get something that is going to at least reassure them for a year. Because I mean, having 10 pads, yes, it might look small, but they can wash it. Because remember, they've never had even one. So having 10 or even 8, I mean, they can wash in the evening and come back, at least know that I'm clean, I can come in and go to school. So that should not be a barrier for them. So it is a highlight for definitely.
And it's a cute little pouch.
I know, they were so cute. The pattern, oh my goodness, the pattern was very nice. I was like, maybe I should keep some for me. No, I'm just kidding. No, but they're very beautiful. Yeah. Anybody else?
Yes, this is this is Rukia.
Oh, hi.
And hi, everybody.
Hi.
I just wanted to add that it was because of hearing in our conversations leading up to going about the women not being able to go to school. It touched me in such a way that my spirit wouldn't let me do anything but be present, to do something about it and to actually be there to see it come. I'm getting emotional speaking about it right now because I do have granddaughters, and I think about myself, the idea of not being able to go to school because of a natural part of your life. It just touched me in a way that, like, whatever we need to do to keep that going, I'm on that campaign. I mean, I'm willing to do whatever needs to be done, but for nothing else, to keep those sisters, those young ladies going about their life and celebrating their minstrels and instead of feeling cursed because they're not able to do and be in their life in the way they're supposed to. God don't make no mistakes. It's supposed to happen every time it does. So that's all I wanted to add, that, and I'm so grateful to your spirit and your energy moving forward with this. And you know what I told you, I got your back.
I know, I got my sister.
I just wanted to add that, and I'm complete.
Oh, thank you. Anybody else? Bree? Somebody? Dr. Kimby?
So this was the second year that we did the pads, but last year when we were sorting them, I remember trying to struggle to make sure like all the girls got a big pad or a panty liner. And as rewarding as it was also difficult because we knew it wasn't going to last long. It was only going to last maybe 2 months. Maybe we gave the teachers extra supplies. So this year I almost cried listening to Miss Veronica because I don't even know how she pulled up that story. There was no way it could have been put any better. But seeing the happiness on the girl's face was definitely one of the highlights of the trip. So
agreed, definitely, I agree. But that's it. I'll get teary every time I listen to that story. I'm like, I am blessed. I am blessed because there is no way, if it was then, how would I have survived? I don't even know of our ancestors, how did they survive? I have no idea. Like, because they made it as being shameful. And it's not. It's not that you can control. You cannot control that part. So it was beautiful. Thank you, Ms. Veronica. I don't know how to thank you enough, but it was a beautiful thing. So it is beautiful.
I wanted to share as well. I remember
Miss
the
Audrey,
day that you guys, the day you guys came on to Woo, it just came in my spirit to tell you there's a such thing as reusable pads. You know, that day I made it like my mission. I'm going to make sure you guys see it, know how to use it, know what it's about. Because my daughter, like I said, she used them for 4 years already. So they will last for a very long time. So, you know, I'm glad that I was on that day. And I don't usually go on Wake Up. I usually see it on the repeat, you know, because it's very early. So, and I have to work long hours. So I was just there that day. And for me to be able to suggest that, and you guys, you know, we buy it, and I showed you the sample, and but then next year we'll perfect it. We'll make sure they have the proper sizes. We're going to do wonderful things with this. And then, you know, I wonder, you know, I really want feedback as to, are they able to wash it? Like, what do we need to do to make sure that, you know, it did work for them, you know, stuff like that. Because like you say, you know, we give them things, but is it really effective in their world? You know what I mean? So I would like to know, does it smell? That's one of the things that I know that I was going to, you know, discuss, but we didn't have the time. But sometimes they do smell, depending on what you clean them with. But it's best to just use cold water. It's the best. That's why it's black. You use cold water, and it comes out really, really well. So, you know, just they have to know. And that's a part of the feedback that I wanted to discuss with the whole project. But I'm glad that I was able to put that in your spirit and that we were able to pull that off. It was a wonderful thing. Yeah.
No, it was a huge blessing, definitely. I mean, I cannot believe, I mean, as like Bree was saying before, the previous year, we did have, I mean, somebody gave us like maybe, I don't know, it was like 10 package Bree last year, but then majority of it was only the disposable pads because we were collecting for postpartum hemorrhage pads. So we had that, and then as soon as they said we can get the girls, so Professor Hector Georgia, she went with a sorority and collected a lot of, I think it was 5,000 disposable pads. And then, so yes, we wanted the reusable, but we couldn't figure out, you know, like the how much. And of course, that time, I think it was 2 years ago, Amazon we couldn't find the reusable sizes and stuff like that. So we went with just disposable. So it was great. And then you jump in, Miss Audrey, and saying, you know what, there's a different kind of this. I'm like, that was as added bonus for that project.
Yeah.
Yes. No,
And then we could amp it up too. Like I was saying, we could amp it up because we could teach them how to sew them. A lot of the women sew. So, you know, you can have a couple of machines there, and those women in their little communities, they can make them ongoing, and it could serve the women that are laboring, the mothers, young children. It can say, you know, help all the women, because I know Veronica did that in Ghana. She was talking about how she sewed reusable pads in Ghana with the women there when she did a mission over there. So yeah, it's something that could be expanded upon, and it's a really good opportunity for the girls. It touched my heart as well. It really did. I was upset about Amazon doing what they did. Like, they really did not. That really took me for a loop. Amazon really didn't give us what we were supposed to get. But it was good, because maybe that was a blessing, because the other women can perfect it, use it, and show the young girls how to use it. So that was a good thing. And it'll be accepted in the community. I really want the feedback, you know, of the parents, how they accepted it, and even, you know, in their, you know, like certain, you know, religious practices, is that accepted? So that's part of the feedback I would love to hear. All right. And I'm complete.
Thank you. Yeah, so we're going to get the feedback from the teachers. So we're going to give them a couple of months, and so that you see, I mean, almost a lot of the girls have gone through at least one after we gave them, so we can get the feedback. And the teachers will let us know if the girls have any accidents or something, whatever's going on, feedback, and what type of the pads and smelling and stuff like that. Yeah, definitely we get the feedback, and we'll be able to learn from it and then make it better next time. Yes. That is great. Thank you. I know, as I said, for me, definitely, I mean, I have so many highlights in the medical mission, especially seeing from the vision of the project through other people's eyes, because I mean, I have my mind set on certain things, vision on certain things, but when I see it through the volunteers' eyes, that gives me, I mean, my heart is full, definitely, for that. Dr. Akabe, did you raise your hand? Because I saw one time, I'm not sure if we were.
Yes, I did. And I was going to tell Audrey not to go too far, because once again, she is demonstrating her research skills, abilities, and determination. I know I mentioned it to her before, but yes, so before we started, and I'm not taking credit for the for the sanitary pads program, but before, when, you know, Dr. Gabone was talking about it, we were talking about it, we were making plans. One of the things that we definitely said that we wanted to do was we wanted to try to develop data, get feedback, and a lot of the questions, the probing questions that you ask, are very important in terms of trying to make sure that the program, in terms of the practice for the end user, as you would say, is actually successful. So we'll keep pushing with that. That part I'll try to help with in the background and stuff like that. But it would be great, yes, if we could try to really get some good, strong data, and try to figure out how best to implement or keep the program going and stuff like that, and make it useful to its fullest extent. And as you said, even to multiply it so that it impacts the community as well. That would be wonderful. So my heart is full, and I'm complete.
Thank you, Mr. Ms. Poso. So connecting from this part, there is work to be done for these young girls. I do have one of my mentees. Her name is Isabel. Isabel, are you still on the call? Isabel?
I think I saw that person leave. Isabella. Yeah, I think she said she had to leave.
Oh, she's okay, but so then we save it for next time. But yeah, so she's one of the high school students here in the state, and she's working with me on a project that's called helping the girls identify their institutions, knowing their body. One of the areas is their menses and of course complication with their periods, things that they need to know. They should not accept and say this is normal. So as a young woman and teenagers, what are the things I need to do? So she's she's going to be part of this project in the future, because she's trying to get her training and education globally, and for using her young version of this project, going through the TikTok and all that stuff. So you're gonna be hearing her more, including this project, because one of the areas is working with young girls identify their endometriosis, that diagnosis, how to ask for help and identify their issues, and then know their body, take care of themselves, doing their menses, cleanness and stuff like that, and make it less shameful than what is being portrayed. Because right now, if the girls mess up their clothes, and people start making fun of them, as if they have a choice to say, okay, I'm going to mess up my clothes. Or their irregularities or their menses, they don't know their date. People are like, how come you don't know your body? I mean, those are the things that you can't control. So she's going to be working with me on that project. And then I said, we're going to hear more about that part. So she was supposed to, she could have gone with us in Tanzania this year, but because we were still young in the project, she couldn't. But in the future project, she will be with us. So, but I'm just so excited to see all the wise ladies helping us in this project and giving the feedback to make sure we help these young women to reduce their barriers to propel them to be successful. And then having menses or difficulty in their menses times should not be a barrier of their success in education. So thank you for accomplishing that, definitely. So the next part, this is just a picture now people are distributing. You can see the headmistress there on the left picture. She is wearing the black hijab there. And then the volunteers giving the girls different here. So the 7th grade are the ones who started getting the 10 packets in there and the bigger sizes. And then the 4th grade, they're getting the younger sizes, smaller sizes in fact. But we're going to be working, as Mr. Audrey just said, that we're going to figure it out, selecting one size that we think is appropriate for all the kids, and then work with that from there and try to order that part. And then, of course, adding to empower them, adding that project of people doing their own, and then so they can choose their own material, as long as we tell them what to put in there so it can make sure it's not, it's a quality product, definitely. Okay, and then the girls, more pictures of the girls. Definitely, they're able to share their pads. You can see everybody's looking at to see what colors they are. More pictures given out and for the girls. So these are good things. So this is just one of the volunteers being in the classroom and getting saying thank you. So you can see those, they're almost kindergarten class. They are saying, thank you, teacher. So because the volunteers are in the class and they're saying, thank you very much. So they learn the English song and try to thank people. Okay, so towards the end. So here's the last day, the last time at school on Thursday evening, where the schools are saying goodbye to us and thank you for us to being there. So I'm just going to play little short videos here for the kids. We can read, we can write, we can speak. Say what teachers, say what parents, what media, thank you, my goodness. Thank you. And then so just little extra activities. Miss Tanya here, she's trying to learn how to carry things on their head, like a Tanzanian, how they carry their stuff. So you can see she's carrying all those thermoregulation kits to take to the units. So we were like in the morning, carry the whole bag. Within an hour, she will come back empty-handed because she's already distributed all those pads, all those thermoregulation kits, where there's the blanket, the onesies, the diaper, and socks into the units. So it was crazy. On the right side, you can see people in the team at school. They're doing the vision screening. I think you can see everybody's having a little selfie. They're having too much fun. You can see all the volunteers have different T-shirts of the QHSC, but supporting QHSC still. And so it was great to see everybody in their element having too much fun and blessing everybody else with their presence.